Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about beginning medical coding credentials. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. I have been a medical coder for over 10 years. I really love to share the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. All right, you want to be a medical coder, but there are so many different medical coding credentials out there. Which one do you get? Which one is the one that will help you get a job? Which one is the one that employers are looking for? Hopefully this video will answer some of your questions. I'm going to be talking about 4 different credentials today, okay? We're going to start off with, there are 2 major medical coding associations, the American Health Information Management Association and the American Academy of Professional Coders. These are the associations that you need to get credentialed with if you want to be a medical coder. There are other medical coding, I guess, companies out there. I can't even call them associations because their credentials are not really recognized. When people are looking for medical coders or even medical billers, they are looking for Ahima or Aapc credentials, okay? Now, Ahima doesn't have any billing credentials, but Aapc does. They have the CPB, which is a Certified Professional Biller. This is for people who, that is their job function, that they want to like run their own business, that kind of thing. Because to be a regular medical biller, you do not have to be certified. Now, I've only recommended, and this is just my opinion, I'm not involved with Aapc in any way, and they don't pay me to talk about them, but I give you guys all of the information because I think it's important that you guys make your own decisions. With the CPB, I recommend that for people who have their own billing practice. At least this way it can give whoever you're doing the billing for some sort of confidence that you have had formal training and, you know, that you're doing the billing. That aside, if you just want to do medical billing, all you need is a high school diploma or a GED. You do not need any sort of special certification. Like I said, the only time you should get a CPB is like if you have your own business, okay? That is just my opinion on that. I have done medical coding job listing reviews for medical billers. Not one time have they asked, or that I have seen them ask for a specific billing credential, okay? And so, moving right along, there are 2 credentials that you can get without having any formal training. If you study on your own, which I do have a video about how to independently study to become a medical coder, there are 2 credentials that you can sit for without having to go through any formal training. That is the CCA, which is a Certified Coding Associate with the American Health Information Management Association. There's also the CPC, which is the Certified Professional Coder, and that is with the American Academy of Professional Coders. Both of these are very good credentials. I currently hold a CCA and proud of it. I'm not going to be a CCA forever, guys. I've got stuff with education going on in the back that I haven't brought to the channel just yet, but I will in due time. So with these 2, you can go through programs and they say, well, we'll train you for either the CCA or the CPC, and that is completely fine. So if you are in one of those programs that teaches you, that's great. If not, if you want to study on your own, you get the practice exam book and you go through all of the pointers that I recommended in that one video that I do have out, and I'll leave that link down below. You know, you can totally do that, but just keep in mind that these are viable. You can get a job with these credentials. So, and you can pick one or the other. And I always recommend that if you are brand new, you have no previous background, no experience, no nothing, to go with just one credential, okay? Either the CCA or the CPC. Now, there is another credential that is the gold standard of medical coding credentials, aside from, of course, the degree designations. I'm not talking about degree designations. I'm talking about the medical coding credentials. Now, when it comes to the gold standard of medical coding credentials, this one credential says that you can code both inpatient and outpatient, that you know how to code with the ICD-10 PCS book, and you also know how to code with the CPT, or Current Procedural Terminology book. And this credential is the CCS, which is a Certified Coding Specialist, and this is offered with the American Health Information Management Association. This credential has an education requirement on it though. You have to go through an approved Ahima program in order to sit for this credential exam. Now, with Ahima, they do have their online program. AAPC also has their online program, but the Ahima program does prepare you to sit for either the CCA or the CCS. Both of these credentials are going to test you on different things, but there are different links, okay? Links of time. With the CCA, it is a 2-hour test, but it doesn't make it any less difficult, okay? You can check the pass-fail rate on the website to know. And in my class, when I took it, there was 34 of us. I was the only one who passed it the first time. So this is not a test to sneeze at. You know, sometimes people do a lot of trash talk about the CCA, which I think is ridiculous and highly offensive, because this is a very difficult test to pass. And not only that, you still have to work hard, because you do have to know inpatient and outpatient coding. I'm just saying, to pass this exam. So there are plenty of jobs about it. Sometimes people will say, well, no one's looking for that. Really? That's why I've done the medical coding job listing reviews videos. And for the CCA, there's quite a few that were looking for the CCA. And they're always looking for the CCA. I've gotten 4 jobs successfully with the CCA. Just saying. But if I had to do it over again, oh, I would do the CCS in a heartbeat, because this one, it says that you can code both inpatient and outpatient. It does open up a lot of doors for you, because there's so many more things that you can do with this credential alone. And like I said, it is really good, but they do, like on the website, on the Ahima website, sometimes they do say that, you know, it's recommended that you have experience before you try to sit for the CCS, because you're coding in this exam inpatient and outpatient coding procedures, and they're testing you on your knowledge of these guidelines for both, because the guidelines for inpatient coding and outpatient coding are different, okay? With the CPC, going back to AAPC, this is an outpatient coding credential. There is no inpatient questions for this exam. It is all outpatient in the outpatient setting. There's nothing wrong with coding only the outpatient. I have only been in the outpatient setting myself, and I'm still successful, okay? So when it comes to whether you want to sit for inpatient or outpatient, if you want to do either or on the coding side, it's entirely up to you. I think that the amount of jobs balances, and it's about the same, but there's just different requirements. With the inpatient side, sometimes you'll notice, if you're looking at the job listings, that the requirement per hour on average is way lower for the inpatient side than it is for the outpatient side. So on average, for me, my current production standard is 90 on the outpatient side, 90 per day, because I'm in a specialty clinic. For other people who have very general clinics that are very easy to get through, for the most part, they have 120 that they have to average per day, okay? Now, with the inpatient side, it is 2 to 3 charts per hour, okay? So this is drastically lower, right? And you think, oh gosh, well, I want to work on the inpatient side because it seems like it's less work. Wrong. So with the inpatient coding, when you are doing inpatient, you're looking at the chart. You are looking at the entire visit for this patient. You are going through all of their rounds, all of the encounters that the provider did for this particular patient. You are looking through all of that information. You are looking at the radiology. You're looking at the pathology. You're looking at all these additional reports and making sure that you capture everything. And you're making sure that you sequence them in the appropriate order. So there is a lot of things that go into that 2 to 3 per hour. You're looking at a lot of documentation versus on the outpatient side, where we are coding based on the documentation. Whatever the provider has documented on that date of service is what we are going on. We cannot reference the day before. We cannot reference past past encounters to get information on a current encounter, that is when it would have to be queried to get confirmation from the provider what actually happened. So with that in mind, it balances out evenly on the difference between the two. Now, I am going to be doing a video later in the week about the inpatient and outpatient, like what are some of the little quirky things and describing a little bit more about that. But you have to know that just because it shows that it's 2 to 3 per hour, it doesn't necessarily mean that it is not equally as hard. Okay, so I am just saying, or not equally as productive wise speaking. Okay, there's a lot of other things that go into the inpatient coding. So all of that said, if you are brand new and starting out, start out with the CCA if you're going with the American Health Information Management Association, or the CPC if you're going through the American Academy of Professional Coders, or if you're being trained for the CCS, then go with the CCS. Okay, those are your beginners. Okay, now yes, the CCS is advanced, but you can still be trained for it properly. Now, there are other specialty credentials with AAPC. They have the COC, which is a certified outpatient coder, and they also have the CIC, which is a certified inpatient coder. If you are brand new and starting, just go with the CPC to start, because the CPC says that you can code outpatient. You don't need the COC. Okay. I have seen the COC being asked for maybe a couple of times. It's not really asked for a lot, okay? And the CIC is the same thing, okay? Most times when they're looking for inpatient coders, they're looking for somebody who has the CCS, okay? They will ask for the CIC if you are with AAPC, but most times when I see job listings for inpatient coders, they're asking for the CCS. So it's entirely up to whoever is doing the hiring. But that being said, don't try to give yourself a bunch of different credentials and think that this is going to help you to get a job much faster, because it's not. They want you to have experience to go along with all those credentials. And also this, when you are getting multiple credentials, you have to keep in mind that you still have to maintain those additional credentials with continuing education units. Now, what are continuing education units? This is we have to do classes in order to maintain our credential. So every credential has a different amount. And if you have multiple, then the number changes, okay? It's going to be obviously more, but it's going to depend on which association you are with. So remember, these get expensive, and especially if you haven't gotten a job yet, where the employer is going to give them to you, because they'll have like monthly coder meetings or whatever. At least at my facility we do, and we get continuing education units for it because it's like a class. So we have that. It is a benefit of my employment, and I'm very glad. Or you can go to conferences, or you can take online educational things that award continuing education units. Whenever I do go to conference, obviously I'm not going to conference this year because of the pandemic. I was upset because, of course, I was supposed to go to Atlanta. I was very excited about Atlanta, but I know. Anyway, but you do get awarded a lot of continuing education units just for going to the conference, because there are so many different things that you can do while you're there. And it's just a really good way to knock out a bunch of continuing education units while you have the chance, while you're there. So just something to keep in mind. You have to look into what your credential amount is for the continuing education units and how many you need. Okay, so that is something to know especially when you are starting in the beginning. But if you want to be a medical coder, you need to be credentialed with Ahima or AAPC. You need to have a CCA, a CCS, or a CPC. Okay, those are the three. If you are doing your own billing, then you can do the CPB, which is a certified professional biller. And that's pretty much it. Those are the ones that you really need to look out for. So if you're going to sign up for a program, make sure this program is training you for Ahima or AAPC credentials. If they are not, then please do yourself a favor and go to another place and find another program, because you're essentially not going to get the value of your money out of that other credential that perhaps no one is asking for. And if you don't believe me, you can go to any job listing website. I use Indeed when I'm talking about these on my channel. This is not an ad for Indeed, but that is just what I use because it's very user friendly and I like it. It just comes up really quick. So I've gone there. If you don't believe anything that I say, you're more than welcome to go to the job listing websites and put in that credential and see if people are asking for it. It's just my advice. You know, you can look. I mean, I want you guys to know that when I say things, it's because I want you guys to have all of the information that you possibly can, because there's a lot of information out there. And there are people who have ulterior motives for what they say. I don't have a dog in the fight, okay? I'm just telling you guys what I know from the years that I've been in. And for me, that I am an Ahima member, should I only be talking about Ahima? Some medical coders that are with Ahima only talk about Ahima. They don't talk about AAPC. I tell you guys about AAPC all the time, so I tell you what I know at least, but so that's it. That's my video for today. I hope that you are doing all of your research. Remember, there are online programs with the associations themselves, and you know, to cut out the middleman of the trade school, because sometimes a trade school is the cost of a car. Online with the associations themselves, it is a fraction of the cost, and they're roughly the same amount of money, Ahima and AAPC, for their programs. So I'm just saying. All right, so I'm going to go ahead and wrap this one up. If you have any questions, please comment below. Let me know. And I will see y'all next time. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.